Well, good morning, everyone. I hope you're all well, and thank you for joining us today for our sixth BILD Calgary Region COVID-19 Safety and Wellness Forum. My name is Brian Hahn, and I'm the CEO of BILD Calgary Region. As we have done for all of our past meetings, I would be most grateful if, whoops, sorry about that. I would be most grateful if everyone would mute their microphones so that we can ensure as best we are able that everyone can hear the presenters. And so I'm just going to do a mute all here real quick to help out in that regard. Also, to help minimize the load on the network and just keep things having the best chance to function technically, we ask that you also turn off your camera feed. Even if you do that, you should still be able to see all that is getting presented this morning. In terms of questions, the most effective way for us to undertake that is for you to type your question in using the chat feature of GoToMeeting. You can do this at any time during the presentation. In fact, we already have a couple of questions in the chat room. And to the extent we have time, we will go through all the questions we receive and endeavor to get you answers to each and every one of the questions. In the event that we run out of time or somehow miss your question, would you please ensure that you include your name and company in your chat request so that we can get back to you once we have the answer. As many of you are likely aware, this week the province of Alberta is tentatively scheduled to begin a measured process for the reintroduction of some businesses to return to offering services, in some ways altered services to the public. Our industry has enjoyed the privilege of having been designated as an essential service. We know that the ability to operate comes with significant responsibility to do whatever is in our power to keep employees, customers, and the public safe from the threat of infection from COVID-19. Having read through some of the documentation that the Alberta government produced along with their daily notification yesterday, there are significant requirements and protocols for the new phase of businesses to open. And again, that phase is scheduled to tentatively begin later this week. I would say, though, there is still significant wariness, if you will, about infection. And my personal expectation is that there'll be significant enforcement, and it will be important that we operate with all due care and attention in terms of protocols. Certainly, as time passes, wariness for those protocols required to flatten the curve becomes a challenge. And it is tempting to interpret the slow and methodical reintroduction of services as a loosening of the restrictions and perhaps maybe even the measures that we have been previously required to adhere to. It's important that we don't perceive it that way. There's still great concern over the prospect of infection and maybe even a second wave, and it is critically important we all ensure that COVID-19 safe work procedures are employed at all places of work and work sites. We're fortunate to have a speaker back today who is returning from previous talks, the safety forums with us. You may recall he participated in our first two safety forums. He is the owner of Kremer Safety Limited, a safety consultant organization that helps companies across Canada with safety compliance, certification, implementation, and management of safety systems and safety training programs. He's also been a safety consultant for 18 years and a contract instructor for the Alberta Construction Safety Association for 8 years. Please welcome, or please join me in welcoming virtually the owner of Kremer Safety Limited, Ernest Kremers. Ernest, I'm going to turn the presentation over to you, and we look forward to your remarks. Hang on a second, Ernest. I'm just mechanically running through things here. There you go, Ernest.
Okay, let's start this again. Welcome, everybody. Brian, BILD, Calgary, and everyone that's here. Thank you for taking your valuable time to look at some of the things that we need to deal with and that are pressing at the moment. So we want to, again, give a great big shout out to all of the essential workers, not only our construction people, our grocery people, all of those essential businesses, including our hospital staffs, our nurses, our doctors, our health professionals, our EMTs, firefighters, police persons, who are so very courageously working through all of this. And of course, we are going to talk a little bit about mental wellness, because it is now approximately 2+ months that we're into this. So if you wouldn't mind, Brian, if you could share my screen, that would be awesome, so that we can get on with the presentation.
Ernest, I think you can from your end there.
I do not have that opportunity at the moment, sir.
Let me just try. I'm pretty sure I. Okay. Let me give you this back. Sorry for the technical hiccup, everyone. Okay, let's give that another try, Ernest.
There we go. Here we go. So we are so into this, and we should have a second or third conversation now in dealing with some of the process where we are looking at. And so welcome and thank you. And these are our key points that we're going to be looking at today. We're going to do a quick numbers update from the government of Alberta yesterday. We're looking at what safety production looked like pre-COVID-19 and now in the present, and how that is morphed and shifted. We're going to look at some of the acceptances that our society are now looking at, some of the behaviors on our construction sites and in society. We're going to have a good conversation about mental wellness, and I'll recount a couple of permanent or personal process. We're going to give you some site observations, and this is where your questions should be on the chat line as well, because you may have a lot to add here, because there's a lot of people that are doing great things, and there's some that are not complying as well as they should be. And then we're also going to have a quick look at what we took a look into, did some homework and some research on what some of the long-term outlooks could look like. So our numbers, hang on one second, I'll just make sure that we've got that. There you go. As of yesterday, and this is from the Government of Alberta website numbers, Alberta had a total of 6,300 COVID-19 cases, 4,278 in the Calgary region, that is 67.9%. In the South Zone, which includes Brooks, there was 1,159, which is about 18.4. And together, ladies and gentlemen, they make up of about 86% of the cases. Our health officer, or our person from the government, is now opening up testing to see where things are at in the hotspot, which is the Calgary and South Zone, because as you can see, Edmonton, the North Zone, Central Zone, and there's some unknowns there. And unfortunately, we give a shout out to Fort McMurray as well, who are now dealing with a flood on top of the forest fire that they dealt with. So they've just been hit hard on a total different level, but it's no less stressful for their continued process. So the reason that I wanted to show these numbers is that if you are working in Calgary in a South Zone, there is an opportunity for a higher level of community transmission, and therefore we want to make sure that the protocols we've put into place, that they are followed. So let's take a look at pre-COVID-19, what safety, production, and quality look like. Safety has always been, folks, an opportunity to facilitate production and quality. And so safety is the process of loss prevention in people, property, and process. That's a standard dogma in our industry. So of course, pre-COVID-19 production, sales, profitability, right? In order to keep a good bottom line, quality is always necessary. For that's what we do, and it also enhances business retention, new opportunities, and our reputation. And then safety, the first criteria was always to physically keep people safe, to then in and balance the health and mental wellness, of course. And that has never been more important today. But we've had a shift in our process here. As you can appreciate, and most of you can concur, that safety is now starting to really put some pressure and process on the production quality. And as you can understand, with the meatpacking plants in High River, Brooks, and now in Quebec, they've had to shut down because the safety of people has overtaken everything else. And so safety is now affecting the production and quality. And in safety, there's been a shift as well, where the health of individuals is now the focal point. Next comes mental wellness, and we still have to look after the physical safety as well. And production is impacted in all areas with the COVID-19 prevention and protection procedures. And then with quality, there's now challenge with completion of contracts. And so we're going to talk about that in more detail as there's challenges with that. So in the acceptance of COVID-19, I think the shock in our society is worn off. And hear me clearly, I say that with great compassion with the loss of life that's happened all over the world, and especially with some of the care homes and such. So I say this with no callousness, but we have now come to accept that our life has changed because of COVID-19. It is now part of our life. It permeates everything we do, everything we plan for, and that acceptance, right, is also an opportunity for that the risk tolerance of people has increased. And so, because it's now no longer the shock that it is. The family units have been impacted, a lot of being cooped up. They're in close proximity, 24/7, especially if there's been isolation because of community transmission. And of course, most of us do understand cabin fever. The weather's been nicer. People are getting together, but the social distancing can look at non-compliance and waiting. And we did see last week where Stanley Park in Vancouver, the pictures they showed on the news where there was absolutely no social distancing. So there's still either a lack of understanding or a willingness of non-compliance. And so all of these factors could affect not only our own health, but also the health of our people on the construction site. So what are some of the construction site challenges these days? And again, I'm just trying to focus on some of them. There are probably and will be others, but I just want to bring up some of the things that we're seeing. Excuse me. Absenteeism. Whether it's out of fear, whether they're sick, whether there's stress in their life. In some cases, in some industries of essential service, the CERB that people are getting paid is more than they are being paid. And so there's a lack of workers at times, and including subcontractors. And so that really affects the production and quality of our work sites, and that could affect, again, the completion of contracts. So you can see how this COVID-19 is now permeating all aspects of our business. And our own business is in the same process as well. We've got to look at a lot of things and mitigate, but not only that, the opportunity for business because of this can also directly affect the bottom line. We'll talk about that a little bit more later on. So social distancing. I totally get it that in some cases two people have to work close together under certain circumstances. If it's heavy lifting, so that is difficult. So the matter of fact is we need to social distance 2 meters, right? And if we can't do that, then we need to look at procedures in order to mitigate and minimize the risk to our workforce. At the beginning of this PPE lockdown and isolation and staying at home, all of the available PPE, and they've ramped that up greatly, there was a lack of PPE available. And so in some of our site observations, we have seen people not wearing anything, and that concerns us greatly. So I believe the PPE is now being ramped up and such. Also, the cost of that. In certain cases, there have been cases where people have price gouged. And so that's not cool. But it is a cost now because now it has to be continuously made sure it's on the work sites, such as sanitizer, right? Masks, gloves, and not only that. Now, attitude, stress. Stress puts a lot of a challenge for supervisor workers and including customers. And so all of these factors come into the mental wellness. One of the things that we're also needing to look at is our emergency response planning with COVID-19, including the first aid challenges. What would happen if somebody has a heart attack on the job site? How do you perform CPR? Have you updated your particular procedures? I will be sending to BILD. We did some homework regarding CPR with COVID-19. It's a 3-page document. I will email that to that, but how do you do 2 meters distance with first aid? So your PPE and procedures need to be looked at to make sure that it includes COVID-19 mitigation, especially when there's airway challenges. So just food for thought, folks, that you take a good look at that as well. So mental wellness. Last week, we've been working hard as our organization for the mitigation of COVID-19 to our workforce, but also to prepare for the future. And personally, I had a bad mental health day last week. And I was morose. I was a little bit cranky. It was a little bit, how would I say this? It was perturbing, but it did bring home that I'm sure I'm not the only one. So our management team have made a decision that if we're having a bad day, that we contact one another, that we have a system in place that we can make sure that we have someone to talk to. Because as I was watching the news yesterday, one of the fellows came back from the cruise ship out of Fort Lauderdale, and he had been on the boat for 8 weeks straight, and he related the fact that 4 of his cohorts had decided to do something permanent and not be with us anymore. So stress, right, especially essential workers, it is there all the time. Family dynamics, the family scope of work. People are at home. And as you know, working from home, a lot of us can work from home, which is the new normal. And of course, a lot of kids are home from school. And that puts stress. Same with finances, home and business. Do we have enough money? And yes, the subsidies are great, but they're going to stop sooner than later. And what does that look like for us? How are we going to cope if we don't have work? And so all of these are part of our mental makeup, which is going to and is affecting our society. And then, of course, as you can appreciate, the amount of information overload with the media is just staggering at times. And the conflicting information that we hear. So everyone needs to just filter what they need to find out and make sure that we make up our own minds, because that never is going to change. So how do you handle the media overexposure and such? So These are some of the site observations. Our company's back to work. We've mitigated, and so therefore we wanted to make sure that we give you some of our observations. First of all, most are compliant. Congratulations. The large primes, larger companies are doing an excellent job of ensuring that the COVID-19 process and protocol, right, is being followed. However, we have seen situations where the complacency, COVID fatigue has taken in, and we are seeing people not wearing any PPE, they're not social distancing, and that is a concerning situation because those are opportunities for community transmission. And therefore, we need to ensure that the consistency is still there as procedures are not being maintained in certain cases. And of course, we're now looking for leadership from our supervisors and management to make sure that the standards are maintained for COVID-19 prevention. But also, we need to recognize that cost is now a factor with mitigation. So the reason we say this is because of what is going to happen long term. So this graphic was taken from the Center for Disease Control Prevention. This is from the Spanish flu. So I will give you a larger picture. And in the pandemic of 1918, there was a huge second spike. Now we have an opportunity to mitigate that large second spike because we have an opportunity to take a flu vaccine, but also we can ensure that we do our control procedures and mitigate and stop the opportunity of community transmission. So in this case, the pandemic of 1918 had 3 waves. And I believe that the authorities, with the research that we've been doing, are really concerned that that second wave is big. So what do we need to do? And this is our long-term outlook. Folks, the infection is going to spread. The countries that have just reopened, South Korea and Germany, have seen a spike in their new cases. One of the things that they've put into place is testing, isolation, tracing, and to make sure that that does not get out of control. So as Brian so ably stated, that there's a measured approach happening. It's going to be stringent. It's not going to happen overnight, and it's going to take a long time. As we did our research, they are looking at, there's already some remedies into play that are starting to assist physicians in mitigating the illness symptoms. The challenge that the medical community is facing is that not everyone gets the same symptoms. We've heard some new ones, such as comatose, blood clotting and such, and that it depends on the person's physical makeup. And the vaccine, they're now talking sometime 2021. And we will not be completely have herd immunity or are safe to work until those vaccines and remedies are into place. And that's going to be at least until 2021. Face masks. We need to ensure that we are wearing those. Now, on the job site, N95s are worn both from a personal protective from the construction part, but also now should be worn consistently personal wherever social distancing cannot be done. So if you're working on a job site and you are in close proximity, please take the time to do a proper assessment. Please make sure that the PPE is available and being worn consistently all the time. Sanitization of job sites to make sure that those are taken care of. And then, of course, they're now looking, and there is terminology out there that social distancing is going to be here with for a year or two yet. Now, the economy, that's a crystal ball. With our research, ladies and gentlemen, as of the latest numbers, there were 19 million unemployed in Canada and over 30 million in the United States, and that was of mid-April 2020. And as you can appreciate, we are tied to the United States as well. So to bring that back from where we are, I mean, these numbers are worse than the Great Depression of the late 20s. It's a different situation, but it's not going to be brought back immediately. Even if when we open economy, things are going to be different, and therefore later this fall, early next year, middle of next year, we're going to see somewhat of a new normal as they open up the process. And we need to understand that there's a lack of confidence with our consumers, and it's directly based to the economic situation of what money they're bringing in. Now, I'm not an economist, but we are doing research to look at what can we do as a organization, as a construction association, and the construction association is very blessed that they've been deemed essential services. But I have such a great empathy to all of those restaurants that have closed. Our CFO, who is a chartered accountant, has other customers who had to go bankrupt already. You know, that's a tragedy. That hurts. That not only hurts the individual companies, but it hurts our economy, it hurts our society. So we are in this together. And so what we need to look at is what happens after the contracts are finished. There are certain situations in our industry where the outlook is not the greatest. However, there's lots of opportunity out there. So having said that, that's my presentation this morning. The whole focus of our presentation is to generate some discussion and some of the observations that you may have encountered. And so therefore, we welcome your questions. So I'm going to stop sharing my screen. And
Ernest, why don't you just leave your screen up and keep it sharing? It's a great backdrop for that.
Okay.
We can just head right into the questions if that works for you.
Yeah, okay, absolutely.
So almost right out of the get-go this morning, we had a question posed in the chat room regarding COVID-19 procedures for warranty appointments and customer walkthroughs, and a request in terms of anyone who's developed procedures for that. And maybe, Ernest, your thoughts on some of those kind of high potential contact ones, the interactions with customers. And I know you talked about a little bit about this in your presentation, but what's some of your guidance on some of those things?
Well, I was in an actual registry office, and at the door entry, there was a lady who was actually disinfecting people's hands and ensuring that social distancing, and they had marks on the floor. They had put in actual plexiglass barriers between the administrative assistants and the customers, and they were all 2 meters apart. And so if you're going to have walkthroughs, there is going to have to be, first of all, an education and expected behavior of the person coming through on what your standards are. And I would highly recommend that if you are doing walkthroughs or appointments at show homes and such, that a protocol be put in place of sanitization, of personal protective equipment, and an understanding by the customer or the person that they're doing this at their own risk. And I know that sounds harsh, but there needs to be an understanding that they have responsibilities to protect not only themselves, but also the person that's going through the walkthrough. So what I would recommend that you do an assessment of how that looks for your particular organization in your particular buildings, because each building is unique, each process is specific to the organization itself. And so get your salespeople involved, get your supervisors involved, have them involved so that they understand clearly, A, the expectation of the organization, but B, how they need to have that leadership by wearing their own masks, by having gloves, and all of those things. So those are just some of my thoughts this morning.
Thanks, Ernest. I might just pile on top of your answer there. Yesterday, as part of their daily briefing, the Alberta government shared a link called Alberta Biz Connect, and we'll make sure that that gets posted on our website if it's not already after the meeting. And there are some specific guidelines for the reopen of the economy related to retailers. And my quick scan just after the question came up is a lot of those look like they might be applicable to the warranty walkthrough piece, or at least could be adapted to that. And that might be another place where the Frank, who asked the question, might want to refer to. I think that's a really good resource. So thank you for your question, Frank. Very much appreciated. And again, the chat feature of GoToMeeting is open for those of you that have any questions of Ernest this morning, or any other questions that we might be able to run to ground for you. Just a few questions from me, Ernest, here this morning. Maybe just take a step back and walk us again through the social distancing piece, and just what our expectations in terms of social distancing on all work sites.
Yes. So first thing is that it needs to be consistently promoted, it needs to be adhered to, and it needs to be held accountable to. I was driving in Calgary. I had an appointment, and I saw a drilling company drilling in a parking lot. Only one of the three people actually had the proper PPE on. And so it has to be complete. People have to wear their PPE, they have to social distance, and supervisors need to maintain the standard. And of course, the site needs to be sanitized. There needs to be hand washing facilities or sanitization gel, but there needs to be procedures that need to be consistent, concise, and maintained. And that is where I was talking to COVID fatigue. Oh, you know, nothing has happened, and complacency can set in. So 2 meters, hand washing, PPE, masks, all of those things should become part of our normal work life completely. Whether at a construction site, in an office, you never know where someone has been. They are now recognizing that prior to showing symptoms, and just when you are showing symptoms with COVID-19, that is the time that the person is most contagious. And so when you're wearing a mask, you are protecting someone else. And when the other person wears a mask, they are protecting you. So I can't stress that enough. And that should become part of our work life new norm, that we wear that PPE and have that awareness. I hope that makes sense.
Thanks, Ernest. Maybe just a little bit more on the PPE thing. Just maybe go into that a little bit deeper. You talked about masks and the prevention there in your answer. Can you maybe just elaborate a little more about masks in particular? And I note that a number of stores, for example, Costco now requires you wear a mask if you're going to go to Costco.
Yes.
Just where the best resources are in terms of getting PPE, and then for those sorts of PPE that are reusable, just some of the protocols around making sure it's safe to reuse.
Absolutely. There's a lot of terminology out there now that people make their own homemade masks. They're also talking that nylons, believe it or not, in conjunction with masks, are actually some of the best process. And of course, we know 95 and 95. They are making N95s and PPE at a great rate now, and I think all of the suppliers are having better supply opportunities. Now, a couple of things we need to also talk about with the social distancing and personal masks. If you are doing a homemade mask, whether it's bought or created, that needs to be cleaned every day. It's same with regular PPE. If you can disinfect it, great. If not, it needs to be replaced. Same with gloves. All of these things should be disinfected. you should also have a containment area in your home when you come home from the work site. And you now need to protect your family. So garages or a self-contained room, which is specifically designed for COVID-19 decontamination, so that you don't bring that into your family. It's not just it's not just the workers you need to protect, but most of all, you got to protect the most precious people in your life, which is your family. So it needs to be a system, and maybe there also should be a checklist in your home or at the job site on what to do from what step at what particular purpose, right? So in my family's case, my son, who's a plumber, is fully PPE'd from the time that he walks out the door till the time that he comes home. And he's actually got a container, a sealed container, where he goes in a garage, he totally disrobes his work clothes, immediately puts them in the containment. He then puts them in the washer to get washed, and then goes have a shower before entering the family space, because his family has underlying health conditions. So that's the level of protection that he has gone through.
Thanks, Ernest. We may have, Stephanie asked a question in the chat. We may have answered it, but her question was, do you recommend the driver where they deliver tubs, showers to site, wear a mask to put people on site at ease? I presume your answer would be yes. And I don't know if the members of Stephanie's team deliver these to, for example, renovation sites where the homeowner might be there. Do you also recommend that others that are on the site or nearby, like owners, also that people also ask them to wear masks and maybe provide them with masks as well?
Absolutely. So how many people are in the truck? First of all, if you have more than one person, guess what? In the truck, you should be wearing masks. Because I'm sure that if you're delivering a tub and shower and you have to install it to, or bring it up to where it is, you're not by yourself. So yes, absolutely, unequivocally. Not only are you protecting them, but you should have an expectation that people are protecting you. So absolutely, yes. Okay, is it Stefan, I believe, or is it Stephanie? So anyways, you only have one in the truck, perfect. But I would recommend, we just had a delivery next door where they were delivering countertop to our two individuals, and they were both masked up and had actual gloves on that were, it looked like very robust. But yeah, it's going to be the new norm.
Yes, apologies to Stefan. I'm going to blame it on the reading glasses that my wife provided me this morning. That's my not so well-functioning protective eyewear. Karen has asked, and I think this is an interesting question, because there's been a lot of media around I'm going to call it the roadworthiness of masks. Is there a way that you can do a kind of a QA assessment on masks that you're acquiring, Ernest?
The thing is, if you're not happy with it, replace it. I love what it said previously, where the surgical masks stated here, blow out, right? So this is where a N95, an actual N95, or a robust cloth mask that meets the criteria would be much better suited. But again, you need to know that A, it is safe for you to use, and B, that it's in the condition as per manufacturer specifications, but also that it's been cleaned or disinfected so that it doesn't create an opportunity for COVID-19 community transmission.
Thanks. Karen has a follow-up question, and then I'm going to get on to Chris's question. A concern about really the reciprocal piece, the protective steps that homeowners can do, and it's not likely that a robust number of homeowners will have access to N95 masks. What advice can you give Karen, Ernest?
Well, the situation is then, as part of when we do the contract, that we have clear expectation of social behavior when your workers come to their homes, that social distancing is now absolute must if they don't have their own masks. So that is, again, an education that is going to be continuous over the next while. But this can be done right at the conversation. Hey, I need you to deliver XYZ. The person on the other end of the phone from the company can say, okay, we have that in stock. We can deliver it so-and-so. Here are the procedures that we need you to take in order to protect not only yourself, your family, but our people. And so I think that two-way conversation is so important that we continue to educate. And then if we don't have that, then the delivery doesn't take place, or other things have to be put, or you bring the PPE with them and ask them to wear that as part of the condition of offer and contract.
So Chris, actually, I thought Chris had asked a question, but Chris has offered, as has been the case for many in this, to share the protocols that he's working on in terms of the warranty appointments. So good for you, Chris. I think that's one of the very interesting highlights of how our industry and our community is pulled together in terms of sharing resources on how to keep people safe. And as much as Ernest mentioned the cost of implementing all these protocols, I've always said there's nothing more efficient and effective than being safe. Ernest, can you just talk to us a little bit more about PPE? And what I would be grateful is if you could just talk a little more in detail about gloves and protective eyewear and the role you see of both of those in ensuring we're safe going forward.
First of all, they have to be worn. In order for anything to be effective, they have to be worn. They should fit. There are glasses out there that have the coverings inside that give a reasonably close seal. Gloves should be worn. A lot of organizations have the surgical type gloves that they put inside of those gloves, and that they are changed on a consistent basis, but that those gloves are disinfected every day, just like your clothes. The biggest thing is that all of the PPE needs to fit. And when you take your gloves off, that you do it in such a manner that you're pulling them off from basically inside out, and then disinfect them. And of course, those surgical gloves are worn while you're disinfecting those regular gloves. And then after that fact, dispose of those surgical gloves. Now, that may seem uncomfortable. I get that. However, my office manager has had a bout with COVID-19, and she said those were 4 of the most difficult days she has ever had to deal with, where she could almost not breathe. I know that it seems we keep talking about the same thing, but the prevention of this, folks, there are now so many people of all ages, whether kids, youth, teenagers, young people, old people. This disease is very, very transmittable. With SARS and Ebola, the R naught. So the R naught means how many other people can someone infect, has been 2. And we did our research on this. The COVID-19 R naught is 6. So one person has the opportunity to infect 6. So you can see how exponentially that could devastate an entire workforce, an entire population. So I can't stress enough, ladies and gentlemen, that we need to put a system in place to create new habits so that the gloves can be worn correctly, they can be disinfected, the eyewear is worn correctly, and that the masks and PPE are worn correctly, because that is what is going to be our best bet besides social distancing, sanitization, and hand washing for 20 minutes. Okay, sorry, 20 seconds, not 20 minutes.
Those would be clean hands, Ernest.
They are. Yeah, and don't forget also, we need to ensure that as we continue to wash our hands, that we also put cream on our hands after the fact, because if they get braided, then there's opportunities for other infections such as staph and such. Okay.
Thanks, Ernest. So we have another question, and that the sender isn't quite identified here, but it's in terms of employee screening, do you think temperature checks should be part of that, or is the self-assessment on the various applications and also on the Government of Alberta website, is that a satisfactory approach to go? The questionnaire that goes through it.
So there's nothing wrong with taking temperature checks. The challenge with the temperature checks are that anywhere from 25 to 50% of people do not have high temperatures while being infected with COVID-19. So yes, absolutely, it's an extra measure. The self-assessment is crucial. And the safety tech system that we showed on our first two is an excellent system to monitor all of that. So we also need to educate our workers to do their own self-assessment and work in cooperation with the employer to make sure that they're arriving fit to work. And when you get visitors on site, that self-assessment is done as well, because it's now a new entity on a job site that is in play.
Another question there, Ernest, in the chat regarding homemade masks. Do you think a hand wash with soap it will suffice? And do disposable masks need to be discarded each day and a new one used, a new one each day?
Well, the medical community says that washing your hands with soap for 20 seconds can take care of any virus opportunities. So any washing, I would put it in the wash cycle if you can, and get that done. So yes, you can use it as long as the soap is like a sunlight that can actually disinfect to that level. If you can disinfect disposable masks, great. If not, then a new one has to be used. Absolutely.
Thanks, Ernest. Just wondering, Ernest, if you take it a little bit, and you touched on this in your presentation, but talk to us a little bit about the communications with the work team and the importance of those, not just from a protocol perspective, but also from, and you talked about mental health, the mental health perspective.
Yeah, we've made it a priority in our organization that mental health, due to the stress of all of this, is a factor to allow people, to have some form of well-being. With all of the negativity that surrounded all of this, and rightfully so, people have been inundated with the opportunity of looking at this, say, why bother? Again, this comes now to our company culture. This comes to our situation where management now needs to take leadership and say, you know what, my door is open. If you're not having a day and if you're having challenges, then come and talk to us. And I want to go back to, as you can appreciate, a cruise ship worker being locked on a ship for 8 weeks, not having the opportunity to go home, not having the opportunity to see family except through media, and then having to deal with that. So the fact that 4 of those crew members, and now this was on the news yesterday on CTV, so I'm just relaying information that's out in the public. Imagine the stress that those people felt and how their mental makeup was to do the ultimate negative thing to yourself by not being with your crews anymore, and you take your own life. So I know that's worst case scenario, but how does your state of mind affect your coworkers? How does your state of mind affect your family when you get home? And so this is where now management and safety people and supervisors need to have some basic education of understanding the question on how to ask the question, how are you doing today? You may be the person that can intervene in a person's life and give them opportunity to get some help or just have a conversation. It might be a 5-minute conversation, and that could make the difference in someone's life. So yeah, it is crucial that protocol, those procedures are put into play, human resources get it into play, whatever your organization looks like, but that's led by top management that states we want to ensure that the health and mental well-being, social well-being is actively engaged in our organization.
Thank you for that, Ernest. Ernest, just maybe if you could talk to us about a little bit more about cleaning and disinfecting of surfaces, and both, I think, in the particulars of our industry, both in kind of the show home or the walkthrough environment, but also in terms of tools and those sorts of things that are used on site.
Okay, tools should not be shared. Let's start with that first. The person that owns the tools or has been assigned the tools, those are their tools. They need to look after them, and they should be disinfected on a daily basis. Job sites, anywhere there's an opportunity for people to go to. So toilets, I would recommend that the protocol be in place that everyone, that their sanitization is available, that everyone sanitizes the porta potty or the washroom area or any area where there is an opportunity for other people to come into, such as lunchrooms, site trailer and such, that there's a sanitization on a daily basis. And if that needs to be more frequent because of lack of compliance, then that needs to take place as well. Because this virus can live on a fairly long time. It doesn't dissipate immediately. There's a day or 2 day or 3 day opportunity, depending on the surface, that can stay active. So sanitization is absolutely a must. So any commercial cleaner, any cleaner that can disinfect should be used. Like I said, when we went to the registration office, there was a lady with a spray bottle at the entrance and was disinfecting her hands. That's the level they've gone to. So disinfecting, sanitization, and if you have an outbreak of COVID-19, now the whole site needs to be shut down and cleaned from top to bottom, just like what they did at the Cargill meat plant in High River. Like, it was an absolute shutdown, and they spent days ensuring that the place was made clean, and they placed special attention to such areas as washrooms, change rooms, and lunchroom opportunities.
So, Ernest, you kind of got to it there. Are there any specific products that you would point, and I don't mean by brands, but you know, bleach or a particular sort of a disinfectant that you would have high on your list that is the recommended a product to use for those cleaning and disinfecting protocols?
First of all, I'm not a chemist. That was not my strong suit in high school, but I would recommend any reputable and I would stay with commercial, especially on job sites, disinfected, where manufacturer specifications can verify that viruses are able to be destroyed. Whether the names of them, I know that there's lots of reputable chemical companies that can, and suppliers that can give you that information much better than I can. But it needs to be something that will destroy the virus.
So there's another question in the chat here from Ryan. Can we expect some changes to first aid requirements and guidelines?
I foresee that happening. My researcher twigged on it, and we haven't delved into it. That's the next phase. But I have it is from the United Kingdom. It is in layman's terms, and I will send this. That could be the start, especially for CPR. I would recommend that your first aiders are especially trained, and your supervisors, on protection when first aid needs to be done, and that is a level above just your basic stuff. So you might need a face shield, you might need doubling up of surgical gloves, you might need surgical masks, those kind of things. So we're going to do some homework on it ourselves and see what we can dig up deeper. That's going to take us a day or two, but we'll see what we can share with the organization. But I will email the CPR one so that we can start with that immediately.
Thanks, Ernest. I think we're kind of getting close to time here. I think Brett has asked us another chemistry question, so he's going to put your and my chemistry knowledge to the test here, and we might have to get back to you on this one,
I
Brett.
think
He's been offered alcohol-free hand sanitizers to purchase. Are these effective to cleaning hands, or should we always be using sanitizers with at least 60% alcohol content?
Brett, I think we should get back to you on that. That needs to be, because unless we understand the chemical makeup, and I'm not a chemist, it should be able to destroy the virus, but I'm not going to make any claim to understanding that or give you an answer to that. But it should have enough content to destroy the virus. And again, that comes back to manufacturer's specification and product information sheets. And Ben, same with that. We need to have safety data sheets if we're going to do commercial cleaners.
Thanks, Ernest. Just to help out Brett, I encourage you, Brett, to just access the Alberta Biz Connect website.
Yes.
Under cleaning and disinfecting, they do have links to Health Canada approved hard surface disinfectants and hand sanitizers to use against COVID-19. So that should help out as well. And with that, I'm going to say we're pretty close to time. We've had a very robust question and answer session. Ernest, you've really been on your toes this morning with numerous questions, so very well done, Ernest. We're grateful for you sharing your perspectives and the wisdom of yourself and your company. We certainly encourage everyone to reach out to their networks and learn as much as they can about accepted and approved wellness. But we're certainly very grateful for what Ernest shared this morning. And Ernest, thank you so much for revisiting this topic and updating so much of the information you shared with us previously. It's greatly appreciated. And we're glad to see that you continue to be well as hopefully we move towards some lessening of the restrictions that we've had. As I noted earlier,